what people want to know about is, what is sciatica and how can chiropractic help sciatica? Sciatica is an irritation of the lower lumbar spine, the low back. And these are the nerves that come out of the lower spine in the portion of the low back in the fourth, fifth, and S1, the sacral area, and S2 down in the sacral area. Essentially the lumbopelvic low back. And it's commonly stressed, and the statistics that I have seen is that essentially about 98% of Americans are going to have low back issues. Oftentimes I hear, well, it must be genetical because my mom had it, my dad had it. The fact of the matter is the majority of people are going to have low back problems. Through physics and engineering, if you look at the lever force and the amount of activity and blatant trauma with bending and lifting and the micro trauma that is produced and the stressors produced on the low back, it's easier to understand. But the production of sciatica is an irritation of the nerve roots that come out of those branches within the spine. Those branches then will bundle together, and then that's what creates the sciatic nerve. The sciatic nerve is about the size of my thumb, which is a large nerve group for the body. And that's why when it gets irritated, it can be very painful. But what we do chiropractically is we go back to the root, rather than thinking about the pain down into the leg, or the pain into the knee, or the numbness in the toe. What we do is we actually go back into the cause. The nature of the cause is within the spine itself. As the nerve roots are coming out of the spine, they're getting pressed on and they're getting entrapped. Pressed, pinched, pressure, however we want to put it. The ramifications that happen with long-term low back issues that will develop into sciatica, oftentimes people will come in and they will say, I've got a bulging disc, I've got osteoarthritis, I've got spinal stenosis, I've got pinching in the nerves. Essentially, these are all the same thing. What it means is that you got problems with your low back. And what we want to do, what we'll make sure that happens, with proper adjusting, we increase the integrity of mechanically how the spine is actually functioning. Because once the body perceives pressure on the nervous system and the spine is in trouble, the first thing it's going to do is lock it down, because with more movement it causes more irritation in the nerves. So chiropractically, what we're going to do is we're going to release the tension on the nerve to allow the body to perceive safety and movement. Oh, now it's okay. Now I can move. Now I can go about my business. Then the body can start to heal. But through time, the tissue on the inside of the spine has actually become weakened. So as we're going through the adjustment process, and that's why it is a process, and we make sure that we go through the proper amount of time to allow the proper healing, because it's impossible for the body to recreate these ill health conditions into healthy conditions within a week, 2 weeks, a month. It takes a period of time to start recreating proper health. As we're changing the mechanics and we're releasing the tension off the nerves, the nervous system impulses then are allowed to change the tissue, the joint spaces, and the muscle strength, and the overall integrity within the spinal cord. People are always talking about, I'm strengthening my core, I'm working on my core, I'm going to get my strong core, I'm going to get my core stronger. But essentially, it's an impossibility to strengthen the core until we've released the tension on the nerves. The nervous system holds the key to the integrity of the core itself. If there's pressure on the nerves, there's always going to be weakness. The studies have shown that as long as there's tension on that nerve, it's an impossibility to exercise the muscles into strength. As a matter of fact, as long as there's pressure on the nerve, because the nervous system impulses are impeded to the tissue that supports, the muscle tissue that supports the spine, this tissue is going to continue to atrophy, which causes more weakness. Then what happens is there is an effect where the larger muscle groups that you can feel on the outside of the spine, they hypertrophy or they get too strong. What then happens is this hypertrophy or the spasm on the outside ends up putting more load force into the spine, and it causes more stress. This continued change in an ill health manner through the years is what creates inadaptability. When that person has developed the inadaptability, it's the, I was putting on my socks in the morning and boom, my low back blew out. I don't know, I was getting into my car, my back blew out. That's how it usually happens, because the spine through time has lost the integrity to actually be able to support itself. The lack of support led to weakness and then essentially blowout. What our job is to make sure that we can take a person in the acute phase or in the crisis phase when they're in that pain status, and make sure that we can nurture them, help them get back into a stable state, calm things down, work on the integrity of the spine, so that after we're out of the acute crisis phase, then now we can start to change the spinal health. This is the key, because if the health of the spine isn't changed, then the problem is going to continue. Because reduction of symptoms is a nice thing, and it's warm and fuzzy, and it feels good, and it's okay, but at that point we haven't really changed the integrity or eliminated the problem. That's why chiropractically what we're going to do is we're going to make sure that we work on the strength, build health, and then we actually work on strengthening the core of the spine. And through that time process, then that leg pain, the knee pain, the numbness in the toe from what we call sciatica, or what we term sciatica, then that's going to change and it's going to heal. But it's not through the treatment of the pain, it's through the resolution of the problem.